All right, so I'll do what we normally do. We'll go through the surveillance report and then open it up for questions if that's okay with everybody. Okay, should look familiar to y'all. This is today's weekly surveillance report. Just kind of hot off the presses, as it were. So we have the first chart shows the overall number of COVID-19 cases in Gallatin County per day per 100,000 people. The gold line is the 7-day rolling average. Our 7-day rolling average as of the 21st was at 50.4 cases per 100,000. That was a pretty good decrease from what we had last week. The trend line on that is going in the direction we want it to go, and we're encouraged, but we're also cognizant of the fact that what we're seeing nationally is concerning, and so we're continuing to work hard, as I think everybody in Gallatin County is, to bring down the number of cases in Gallatin County. But we're also just really conscious of the fact that not all parts of our country are going through that. The variant form of the virus, or maybe multiple variant forms of the virus, is causing concern. And so we want to make sure that while we're encouraged to see the trend line going downward, we need everybody to really understand that this can change quickly, and it will really depend upon the level to which people are willing to continue that social distancing, continue wearing face coverings, continue washing their hands, continue staying home when they're not feeling well. I really think those are the things that are helping us turn the corner on this in some respects. But we still have a long way to go. We still have months of this ahead of us, and we could see surges in the future. I hope we don't, but we could. What you also see here is a decrease in the positivity rate. That is the percentage of tests that we're seeing that are positive. That's down from 7.9% to 6%. This is including all the test results that we get, including those in Big Sky. When I include the Big Sky numbers, it's still below 10%. In fact, I should pull that up and make sure I get you the right number. Yeah, so if I take out the Big Sky numbers, that 7-day rolling average as of the 19th was down to 9.1%. So, somewhat of a difference there, but not dramatic. It's still showing the same trend, the trend of a decreasing positivity rate. It's encouraging it's below 10%. It will be really encouraging if we can get it below 5%. Testing, the state of our testing system seems pretty good right now. We're getting test results back in a median time of 2 days. That is encouraging. We're seeing, when I roll by the testing sites, I'm not seeing incredibly long lines, and we're seeing results coming back in a somewhat timely way. Again, we are seeing a little bit of an increase in the number of tests that are coming back after 2 days. We're just going to keep watching this. I don't see it as a pervasive problem right now. We'd rather see most tests coming back in a day, but within 2 days is reasonable. The sooner they get back, as you know, the more effective we are in our contact tracing. And then you can see the time from the time we receive a test to the time when we're starting an investigation, at least making an effort to contact the known case. You can see that is almost always now within a day, and most of those get taken care of on the first day that we get them. Doesn't mean we get the entire investigation done, but it does mean we're able to get to that case and start that process. Onset date, you can kind of read this for yourself. Again, that the yellow orange shaded area is incomplete data just because we haven't gotten through all those interviews yet. But this is the most immediate and time sensitive indicator of when we are seeing people getting sick, when people are feeling the initial symptoms, if they do feel symptoms, the date that they feel those. You break it down by age. That's pretty self-explanatory. The red bar is people in their 20s. The yellow is people in their 30s, and you can almost predict from there. Well, I guess the blue bar is people in their 10 to 19, probably driven by people in their late teens. And then you can kind of go down. And as you get older, you see, thankfully, you have fewer cases. And then MSU numbers are in the report as well. We're still early in the term. The number of active cases is pretty stable to where we were last week. And we'll continue to work with MSU on making sure that we're doing that contact tracing together, making sure that the folks are getting into isolation and quarantine when they need to. And then the testing system is running and is available. And then you can see the number of schools. We still are continuing to see cases pop up in a large variety of schools. So that report is now on our website. You can access it directly, along with the school's supplementary report that we put out on a weekly basis. So with that, presuming you guys can still hear me, I'm happy to take some questions.
Hi, Nora with the Chronicle here. I'm wondering about the positivity rate. It seems like it's been above 10% for a while. Is getting that below 10% a big deal? And kind of, I guess I'm kind of wanting to put that in context in terms of how that's been throughout the pandemic.
Yeah, I mean, as you may remember, in the summer, we were running below 5% for some period of time. And then in July, it popped up and came back down again. It's a good thing to have, if you have testing availability, which we seem to have. It's a good thing to see that positivity rate trending downward. It means that with available testing and with the overall percentage coming down now, if you read the text that's been in that report for months now, what we talk about is you really would like to see it below 5%. Once you get between 5 and 10%, you start to be in that sort of moderate degree of concern. And then above 10% is when they really the public health authorities start to say, okay, now we're seeing spread that may be spreading without enough testing to catch the cases. And so we want to make sure that we're doing everything we can to provide the level of testing that people need, and do that contact tracing to reduce the amount of spread. So I would just say that, it's going in the direction that we want it to go. It's doing it gradually. And we would like to get it below 5%. If you can get it below 5%, that is you're in a situation where you're have a chance to contain spread when you do find cases. So it's better than it has been. I mean, heck, in November we were over 20% for a period of time, and that is absolutely a sign of uncontrolled spread. We're not there anymore. We're not really particularly close to that, and that's a good thing.
Okay. And I just had a question about the vaccine stuff. I'm wondering if there's any updates on getting doses into Gallatin County for the 1B phase.
Yeah, I know everyone's really anxious about that. We'll be starting 1B shots next week. The fundamental problem we have is that we don't have enough vaccine it's fine for Helena to say we're in phase 1B, but everyone needs to understand we don't have enough vaccine to meet the demand for everybody in that group. It's not even close. You got a shot glass full of vaccine and we need a swimming pool. And so that's not anybody's fault. It's not pointing fingers. It's just reality. It's where we are right now. And we just need everyone to exercise some patience. Next week, we have about 1,000 doses. Now that we have 1,000 doses to give, we have 2 points of dispensing clinics planned for the fairgrounds next week. Those clinics are going to be focused on finishing up the people who we have on wait lists for 1A and starting into 1B. And by the end of next week, all of that vaccine, our intention is to get all of that vaccine into people's arms. But we know that's not going to be nearly enough to satisfy demand. The problem is we just don't have enough vaccine. And that's the same problem that we're seeing in counties all over Montana and frankly, in states all over the country. We're doing what we can to build our system here locally so that when vaccine does come, we'll be able to get it out to people in as timely a manner as we can. Again, this isn't vaccine that we are getting now, and we're making plans to dispense it next week. And then we're going to continue to do that and continue to get it out there. We do have a little bit of information. I'm going to turn it over to Patrick Lonergan a little bit. He's going to talk a little bit about a new notification system that we're launching that'll allow people to sign up for text notification for how they can get information about the vaccine and about administration. Patrick, you want to?
You bet. Good afternoon, everybody. So we've leveraged a couple tools that we have to try and provide some options for the community to opt in and receive updates on kind of where we're at in the different phases, when things change, and when we do have pods available, how they can go about registering for those. So it's kind of two separate systems to meet two different needs of individuals. So the first one actually comes out of our community notification system. And I'm sure you all got the press release earlier today that outlines that. Basically, by texting the group that you're interested in receiving information about to 888-777, it'll enroll you in to the system, and then we can send out bulk text messages to those that have opted in, providing those updates to them. The nice thing about that is it's easy for people to subscribe to the phase that they care about. And then at any point when they choose they no longer want to receive those messages, they can simply type in stop and unsubscribe from that and go about their business. The second portion of that, for people that want to receive emails with the same information, we've created some Google groups through Google Enterprise where people can subscribe via email, and the same deal. They can subscribe to it. They become a part of that email list. When we send out the updates, they get them via their email. And when they no longer want to receive that information, they can click unsubscribe and stop receiving that information. So those are the two tools that we've been able to roll out today to help people get information either through text message or email when we have that to push out when things change. And I will stop at that for any questions.
Let me just add into that these are just two tools that we're using. We understand that especially the population that is eligible in phase 1B is an older population. So we're utilizing healthcare workers, we're utilizing senior centers, tons of other partners and other tools to make sure that this information is accessible to everyone. But I just really want to emphasize that these are just helpful tools, but not the only way that we're communicating with people who are eligible in phase 1B.
Yeah, and I hope you all will communicate to people that people don't have to use this text system to get a vaccine. It's not a requirement. And if there's people who can't or don't want to, that's fine. They don't have to. It's just one more tool that we have to push information into the community to make sure that we're giving as many people. We'll continue, as Whitten said, we're going to continue to use the newspaper, continue to use television, continue to use social media, continue to use our partners in the community like senior centers and healthcare providers but this is one additional tool that people have. I just don't want people feeling like they have to use this if they don't feel comfortable with it or they don't feel they have the capacity to do it.
I have a question. I'm Rachel, Yellowstone Public Radio. It's been a while. How do you know when the people in phase 1B that everyone who wants to get a vaccine has gotten it and that you're ready to move on to the next phase?
Well, demand will be part of it. I mean, when we start putting up notices of points of dispensing and we have a hard time filling them, that's going to be a pretty good indication that we've saturated that group. Or if we have a hard time filling them with people who we think fall into that category.
Moving into next week, I got a question too then, more coming back with all the setup for phase 1B, which is the big week starting next week. What's the morale like with you guys as healthcare workers on the front lines, especially with the 2 places at the Gallatin County Fairgrounds and so forth? What's the energy like going into this week?
You know, I think the arrival of the vaccine has made everything more complicated and added a whole sort of area of work that we didn't have 3 months ago. We were really glad to have that work. We're really glad to be able to have a vaccine, and it feels. I'd say the morale is good. I think we understand that there is a high amount of demand out there. I talked to our folks last week and they said, look, we have to be understanding that people are really anxious to get this vaccine, and we just don't, as a country, have enough vaccine to go around right now. We need to be patient with that. Both we're asking the public to be patient with that, and we have to be patient with the public. And so I would say morale is good, but it's a lot of work, and it's complicated. It's not just as simple as calling people to make a big line at the fairgrounds and jabbing them in the arm one at a time. We have 2 kinds of vaccine. They have to be administered twice in a set interval. We have a need because of the pandemic to have social distancing, which means we need to have appointments. We have multiple different healthcare providers. We have people who don't have healthcare providers. We have people who aren't connected to the systems. We have a population that right now is most vulnerable, that is not particularly mobile all the time, and they're not particularly tech savvy all the time. And so those things all make it really complicated. And the biggest complicator is we just don't have enough vaccine to go around. And so anytime we get vaccine, those points of dispensing get filled up pretty fast. And we understand that there's going to be some frustration with that, but we're going to just keep doing everything we can to build the machine to administer the vaccine safely, as rapidly as possible, and as transparently as possible.
And part of this machine now sounds like with this new email / texting, at least the notification wise, this streamlines it a little bit more, right?
Well, I think it gives people, what we're trying to do with this is make sure that people have a way to have some confidence that they know what's going on, that they don't have to worry about falling behind. If we have information about vaccine coming in or a point of dispensing, and that will be a way that we shoot it out, and people will be able to get that information. They can do it for themselves. They can, if they've got a family member they care about, they can sign up for that information so they're aware of it. So we're hoping by providing information and providing a way for people to have some confidence that they're going to get it in a timely way, that will remove some of the uncertainty and some of the maybe some of the frustration that comes with the situation where we've got a lot of people who want something and not a lot of it.
Sure. Okay, that was it for me.
Other questions?
I had another question if no one else has one. I'm wondering what the communication with the state has been on getting the doses.
Good. We have gotten, like I said, this isn't this isn't anybody's fault. This is just the situation that we're in. And we have regular and ongoing communications with the Department of Public Health and Human Services. They send us information at the beginning of the week related to how things are going in other counties. And they're starting to get to a point now where they can give us some visibility in the week or two ahead of how much we can expect to come. We've been given some information that over the course of time, we can probably expect about 1,300 doses in Gallatin County a week until the overall supply loosens up. And that's not just the health department, that's all providers. And so that gives you a sense of scale in terms of this is going to take a while, but I would say that they have regular ongoing communication in a number of ways. They both via data that they send us, they have regular phone calls for lead health officials and health departments. And we've worked with them long enough. I can pick up the phone and have those conversations with people. So in general, I would say the communication is good. You guys are quiet today.
Hey, Matt, Noah Schmick, ABC Fox, Montana. I was wondering how the vaccine rollout, specifically to the nursing home residents and assisted living facilities around Gallatin County have been. I know the Gallatin Rest Home is above 50%, I believe, on their both the people living there as well as the staff and residents. I just was wondering if you got any numbers on that.
Just to be clear, that whole effort is being undertaken through a federal contract that the federal government has with some commercial pharmacies, I think CVS and Walgreens. So that's not the health department that's doing that. However, we have staff who is in touch with those long-term care facilities here in Gallatin County on a regular basis. We've kind of gone in behind and made sure that all of those facilities had been contacted by those federal contractors. And we're there to answer questions and to encourage people to enlist in those. And I think from what I've heard, it's gone well. We're hoping that we get a really high uptake in staff. So as far as I know, it's gone well, and we know that they've contacted all of the long-term care providers in Gallatin County because we've checked, and we wanted to make sure that they were getting aligned with a provider.
Perfect. Thank you.
Other folks?
All right, and real quick, roughly how many people would be in phase 1B for Gallatin County?
That's a great question, Rachel. I mean, it depends. It's tricky because, and I shared a slide during our Board of Health meeting, and maybe I'll have Whitney send that out to you. The tricky part of it is you have to look at age, but you also look at underlying health conditions, and there's going to be overlap in those. And even within the underlying health conditions, there's going to be overlap. There's thousands. I mean, let's just put it that way. There's going to be thousands, and I'll have Whitney send you guys the best information that we've had to share with the task force that's helping us figure that out. But there's not a simple way to slice and dice that, but let us get the best information we have, and we'll email that out to all of you. Other questions? Okay. All right, y'all. I think I heard the governor has a press conference. You probably want to get to that. I appreciate your time, and I hope you have a good weekend.
Thanks, Matt. You too.
Thanks, Matt.